Welcome back to the Medical Disruptor podcast, where we dive deep into conversations that challenge the status quo in medicine. I'm Dr. E, and you know by now that I like to challenge the status quo, and my mission is to break down the barriers, get rid of medical gaslighting, and empower you to take control of your health. This season, it's all about introducing you to other trailblazers who are also rewriting the rules and giving you the power to take control of your health like never before. This week, I'm fired up to have Dr. Joy Kong on the show. Dr. Kong is a force of nature in regenerative medicine. I mean, she is really shaking things up. With triple board certification and as the president of Cara Health in Los Angeles, she's leading the charge with cutting edge treatments like stem cell and peptide therapy. And boy, let me tell you, the FDA is kind of mad. She'll tell you all about it on this. She's also the mastermind behind the American Academy of Integrative Cell Therapy, where she's training the next generation of doctors to push the boundaries even further. Get ready for a conversation that's going to open your mind to new possibilities about your health. Dr. Kong is really going to take us there, and you don't want to miss this episode. So I am here today with another medical disruptor. And I'm privileged to meet medical disruptors all over the country. But before we tell everybody what a medical disruptor you are, I think after they heard all about stem cell in your intro, why don't we just get everyone right in on the same page? What are stem cells and what is stem cell therapy?
Yeah, Dr. Yi. So stem cells is one of those inspiring subjects that I think that all the craze and all the buzz about it may undermine just what an incredible gift that we have come upon at this point in our medical, medical arena as a field, because we are utilizing the blueprints of nature, the intelligence that's embedded in the blueprints. Now we're putting the cells, we're injecting the cells into the body. Somehow the cells know what to do because it's like what's called pleiotropic effect. So it has multitude of actions. These cells, because of the DNA and because it has a capability to respond, it can get to the site where they're needed and start to secrete all these incredible molecules, right? I call it like an intelligent pharmacy. So it's like you put in a little pharmacy that has intelligence of God that created us, right? That's what's transferred into these cells. Because till this day, we cannot make a single cell. So with these cells, then all the intelligence that's given to them that can form a full human being, if they just use a fraction of that intelligence to tell our bodies what to do, how to get your immune system on board, how to break down scar tissue, and how to form new cells, just a little bit of that intelligence, and that can produce profound changes. So this is why it's so revolutionary, because we have 1,000 gradations of different kinds of stem cells since the start. Since we started as a fertilized egg, there are thousands and thousands of different kinds of stem cells until we reach a final tissue-specific cell, right? Liver has a liver cell, there's neuron, there's muscle cells. So all these are end stage, right? That's all as far as they can go. They've gained full function and they can't form any other cells. But any step before that, there are stem cells. So when people talk about stem cell therapy, it's not like we're utilizing a kind of cell. We're using one of the thousands of types of cells. And it just happens that these days, the most popular one is called mesenchymal stem cells. So these are everywhere in the body because till this day, thank God, we still have all these stem cells floating around in our body, because before we didn't know stem cell existed. So up to the 60s, when they started doing bone marrow transplant, at the time, they still didn't know that was stem cells.
Before you go on the history, I want you to give us one sentence. What is a stem cell?
Okay. Stem cells are self-renewing cells that have the capability to differentiate, to gain function, but replenishing itself at the same time. So it can make a copy of itself, and then it can replenish the tissue that they populate.
And basically, correct me if I'm wrong, I just want to make sure, because we're going to blow everyone's mind, I want to make sure they really understand what stem cell is. Basically, we all start as stem cells.
Oh yeah, we are. Right? We were one stem cell.
We are. So we are stem cells before we become humans, before we become embryos, right?
Yes.
We're stem cells. So stem cells first. And from the stem cell, I just want to make sure the audience understands the power of what you do. From these stem cells, everything comes from there. So it takes steps, and then eventually one stem cell will become a liver. Eventually one stem cell will become skin. One stem cell will become eye. But the point is that the stem cell can be anything. So now, as we go through the rest of this podcast, I just want the audience to know, so just imagine if you have this cell, that's what's undifferentiated, meaning it has not become something else yet, what the power of that is once we put it into a body. So now that we understand a little bit like what a stem cell is, what the
Yeah,
word
but there are so
undifferentiated
many
means.
different kinds of stem cells.
Tell
So
us.
when the embryo is forming, until the embryo is forming a specific organ, the heart is appearing very early on. So when you form a functional heart with heart muscles, that is the end of those stem cells' fate. But there could be all these different steps right before it becomes the heart cell. So as they gain function, gains their specialty of what where they're going to go, they lose potentials. So they can only become maybe in the cardiac lineage, and then they forego all the other ones. So all the other genes were shut off, but particular genes are turned on. So there are all these, it's not, if we use a stem cell, it can become anything. No, depending on where you catch them on the pathways of the stem cells. So people need to understand that it's not like a one miracle, a stem cell, depending on which kind of stem cell are you using.
All right. So would you say that, just so we have a visual and so that I understand it also, because I need things explained to me on a 5th grade level, that when we're being formed as humans, there is perhaps one, I'm going to say mothership stem cell, but then depending on where it is, it already may have chosen a path.
Exactly.
So it might be on the path to become a heart. It might become a path to a liver.
Yeah.
So the stem cells that you said are still in our body, have they chosen a path?
They were in the mesoderm layer. So when the embryo is forming, there's ectoderm, mesoderm, and ectoderm. So there's 3 layers, and each layer form different types of cells, right? So the mesoderm form muscle, spleen, muscle, a bone, cartilage, fat, etc., and a few internal organs. And ectoderm, the skin, the nervous system. So the mesoderm will have these particular cell types, even though they come from mesoderms, but they've gained a particular role in the body, what's called a kind of a signaling cell type of function. I call them the master of regeneration, like a conductor in the symphony of regeneration, because since they are evolving along with the blood vessels, etc., they're hugging the blood vessels. Anywhere you have blood supply, you will have these mesenchymal stem cells. I think of them almost like a gecko holding onto the wall of the blood vessels, and they have all these tentacles touching the blood vessels, sensing what's flowing through the blood, and they're touching the local stem cells and other cell types. So they're always communicating with everybody. And depending on what's needed, either they send signals into the neighboring environment, causing what's called paracrine effect, or they can squeeze themselves into the blood vessels, start to swim upstream to find the signal where the signal is strongest. And so that's the homing mechanism. And then they can squeeze themselves out of the blood vessels to start working in the local area. So they're sensing what's going on in the blood, and then they're working in the little neighborhood that they're in.
Okay, so you're saying that before we get to how to utilize it in stem cell therapy, we already have these stem cells. Not only do we come from stem cells, every single part of us, but we also have some stem cells in us. And depending on the body's needs, they're activated. Right? And so you said, oh, they know they need to go upstream if they need some in some way, because they're constantly in communication. And when they get activated currently, what can they get activated to do?
So we're talking about the whole array of mechanisms of what these mesenchymal stem cells can do. There are all kinds of other stem cells we utilize. For example, when you do bone marrow transplant or umbilical cord blood transplant, there were a lot of primitive immune cells, and they can become all kinds of different types of immune cells. The hematopoietic progenitor cells also can form the entire blood system. The endothelial progenitor cells can help form the blood vessels. So there are different types of cells, right? But if we're just talking about mesenchymal stem cell, which is powerful because what it can do is this multitude of effects. One, it's highly anti-inflammatory. And we all know inflammation drives chronic illnesses, and almost all chronic illnesses and perpetuate it. So if you can calm the inflammation, and you can reduce the rate or severity of your illness and symptoms, and also it slow down the aging process because inflammation drives aging as well. So that's number one. Number two is that it balances the immune system. So mesenchymal stem cells has the capability to help shift the immune system from a more pro-inflammatory to anti-inflammatory state. That has been proven over and over by it secreting different types of cytokines and really help make the immune system work in a more harmonious, in a more balanced manner. So if you have low immunity, it can boost your immunity. If you have overactive autoimmune type of tendencies, it can calm you down. And then on top of that, have all these fun benefits, capabilities. One is that it can break down scar tissue. How cool is that?
So
How many
cool.
things can you tell me?
Nothing.
Right? You've been in medicine doing primary care for a long time. What can you give patients to break down scar tissue? Okay. But okay, now we can resort to a little more than prayers. We can give them stem cells that have anti-fibrotic properties. I've seen that in liver cirrhosis, in pulmonary fibrosis, such as situations like COPD, of course, in scar reduction on our surface. So powerful. And then it can help promote more blood vessel formation. So basically enhancing blood supply, right? If you form new tissue, but with no adequate blood supply, that's no good. The tissue is not going to flourish. So it can help generate more blood vessels. And it also has the capability to rescue damaged tissue. So let's say, especially in a lot of situations, we all know when we treat patients like in stroke or crush injury or chemical injury, you have cells that were directly assaulted, right? Cut off with oxygen supply, and they're dead. But the neighboring cells don't have to die. But darn it, these cells send out all these signals, sending out this cascade. All of a sudden, you got like the stroke, you got a big infarct area. When the stroke, the blood supply was only cut off in a small area, the stem cells can come in and tell all the neighboring cells, hey, you don't have to die. There's nothing wrong with you. So they can reverse that process. And they have the intelligence to detect cancerous cells, some things or precancerous cells that don't really belong in the body. So there's something really wrong with the cells, especially when the stem cells are younger. They retain a lot of the intelligence to detect cancer. So they can send out signals to tell the cancer to die. So that they have apoptotic capabilities. So that's really important. They can also help with something like mitochondrial transfer, right? We all know mitochondrial dysfunction, how much that reduces our vitality. So the younger stem cells will contain very young, very fresh mitochondria. They've caught on electron microscopy showing that the mitochondria can walk across microtubule bridges into another cell, like macrophage. So all of a sudden, you're elevating your immune cells' vitality. And they also send out the mitochondria in all kinds of ways, like they spit it out into extracellular matrix, right? It just floats around until it probably finds another cell. Or they can put in the huge vesicle, and that huge vesicle can fuse with another cell, and then dump the mitochondria into the other cell. So it's really cool. I just think it's super fun to know how these cells can help the body. Yeah.
Okay, so question before we get into how you use the therapy or practice. Initially, when you first graduated medical school, what kind of medicine did you practice?
I went into psychiatry. One of the rebels.
So you went into psychiatry.
Yes.
So what was, like, I know my story of why I got into functional medicine. What got you into the decision to use stem cells on patients?
One, I've always known the limitation of Western medicine. Growing up in China, having used both Chinese medicine and Western medicine on a daily basis, right? For myself, my friends, my parents, and seeing Chinese medicine making profound differences and knowing that they've got something going on there. A few thousand years, look at how many Chinese there are. Ayurveda, look at how many Indians there are. Like, what's going on with these flourishing populations?
They did just fine.
Right. So what I realized was I love science and I love the linear thinking. It's really cool. The linear from A to B. Whoa. We found
algorithm.
We found exactly what's going on from A to B. But that's not end all be all, because there can be a lot of A to Bs. And then they all form this mess this drastic web. Just like when I started doing like I've done neuroscience research, or just go to conferences, look at any neurodegenerative condition. You can see a chart of thousands of compound all in that chart, right? One is affecting this thing positively, causing increase in this level. And the other one is causing a decrease in this level. And it drives you nuts. It's, oh my God, how do I decipher this whole web of things? So there's a limitation on how far you can go with your A to B approach. You've got to come a little bit layer higher and go into a system approach. And that's where the Eastern medicine has a way, has a language, has a experience with the system. So I've always wanted to incorporate that in whatever I'm doing for patients, because my own mom's life was saved by Chinese medicine. Not that Western medicine did not help, but my mom was diagnosed with multiple myeloma when she was only 43. I was only 13 years old, and my brother was only 8. My dad thought he was going to lose my mom in a couple of years. It was very traumatic, devastating time. She stayed in the hospital, the best tumor hospital, cancer hospital in Beijing for 6 months. She lived there. She went through 6 rounds of chemotherapy, and she saw all these basically ward mates walking in and then being carried out on a stretcher dead. So finally she said, get me out of here. I'm done with this treatment, because she lost almost all her hair. Her veins were blackened. She's fainted during chemotherapy. So what did she do? She came home. She went to a Chinese medicine doctor who specialized in boosting immune system and who wrote, 20 different things, all these herbs that you can brew that smelled horrible. And my dad was brewing her morning and night. So she drank that nasty drink, brown drink. And then she did aerobics. That's all she did. She just sat at home, drank this medicine, did aerobics in the morning. Within 6 months, full recovery, complete recovery. So what's going on there, right? The doctor who was the head of the cancer ward came to our apartment asking my mom for the recipe of this brew, because he ended up using that, bringing that to the cancer ward to give to all his cancer patients. So there's something going on. What is Chinese medicine doing with this multitude of things, insects and tree barks and mushrooms, whatever they put together? Somehow it can produce these effects. So I want to give people whatever that can really amplify their body's ability to heal. Stem cell therapy. So when I was searching for better ways to enhance the body, I got into functional medicine, which is a more holistic approach in medicine. It's a fairly new branch of medicine. And that has that philosophy of looking at the system, your body in a very complex whole, right? You're looking at a lot of different things and putting all the pieces together. And of course, people who are in functional medicine or holistic integrated medicine, or later on anti-aging medicine, is all along the same vein. And these are the most open practitioners in the field, in medicine. And they're more open to something like stem cell therapy.
Of course.
So the first doctor I met who actually did stem cell therapy was in anti-aging medicine, right? It sounds like, what was anti-aging? It's not about just looking young. It's about preventing the decline that's triggering to get sick. So if you can slow down the decline, all of a sudden you won't be sick anymore. You won't get all these serious illnesses. And when I met this doctor, he had treated in an autistic kid. And I mentioned I was a psychiatrist. I had wanted to go into child psychiatry because I thought I wanted to intervene early, until I was at Cedars-Sinai working with child psychiatrists and seeing that she was mostly seeing autistic kids. And she was not making a fundamental difference. This is a high-end, top-of-the-line hospital, right? Treating autistic kids. What I saw was sedation. We're throwing all these fake drugs, antipsychotics, anti-anxiety, or stimulants at these kids. We're just trying to make shifts. We're throwing like darts on the wall to try to shift their brain, either to be a little more focused or to be calmer so they don't cause problems and disruptions. We're not fundamentally helping these kids to gain skills, to do any better. It was very discouraging. But this doctor who gave a single IV infusion of stem cells, he showed me a list of all these changes the teacher observed. The teacher had no idea the kid got stem cells. The teacher was like, whoa, your kid now is more verbal, is playing better with the other kids, is doing homework more on time, and has better eye contact. It's 40 things. It was mind-boggling to think that here, this doctor, he was an anesthesiologist, right? He was not a psychiatrist. He just put some cells into the veins of this child, and he was able to produce results that I have no idea how. So that was my first clue. There's something going on here. I better look into this. This is a powerful clue.
That's amazing. So then we all have our stories, and I love hearing about stories. My story has to do with my wife and how we healed her. And then, and when you go into functional medicine, you first have to be in medicine and PAMD, and you have to learn all that first. And then you have to unlearn it and learn new things, which is what I love. And I love hearing about stories because it's different when you go into what you say. I call it algorithmic medicine, which is necessary and we need it. And it has a space for it. And I'm not anti-medicine and I still prescribe medicine. But you have to go through something, experience something. And you're like, what? It's the limitations. It is so limited. And we're really falsely made to believe that doctor knows best. And as if there is no limitation. And
as a reminder, medical mistakes is the third leading cause of death, right? Yeah. And those are just mistakes.
Yeah.
Do you know how many regular practice of medicine, how much damage, morbidity, mortality it has caused? But because it's under the practice, right? You actually practice what is accepted. Those are not considered mistakes.
Now, I was going to...
You go to the doctor at your own risk. I'm sorry.
I was going to get to this towards the end, but let's do this right now. So before we started, the name of my podcast is Medical Disruptor. And now I'm in this space where I'm interviewing other medical disruptors. And there is a risk that we take. I have a thriving primary care practice, and I could have just stayed in my primary care practice. Thank God, it served a lot of people and it serves the community. But from my journey, I see that's not enough and I had to veer off the side. But you take a risk. People from conventional medicine will call you names, will come for you. But I feel like once the blinders have been removed from my eyes, I can't go back. I can't go back. So tell me a little bit about that. Like, I know you're a serious medical disruptor. Stem cells, no joke. Tell me a little bit about, you said something to me earlier about in the podcast, like first a little bit about the backlash, but then also you said something about what you do versus what happens when you go into conventional medicine. Tell me.
Yeah. So it's definitely a lot easier if you just follow the program. We were programmed to wait until people get sick so we can become useful, because our use comes in starting a diagnosis. We have all the tools, right? We can do imaging, we can run lab tests, we can run whole lots of lab tests. And we talk to the patient, do some exam. And so we do our differential diagnosis. That's a whole medical training, right? It's all about differential diagnosis. How can we diagnose people? We focus on diagnosis. Why? Because the diagnosis will lead to drugs. Because drugs are approved only by diagnoses, right? You're approved for a certain condition. So the doctor, the moment you find your diagnosis, voila, you feel like a hero, right? Now I know what to give you. Now I'm useful. But what about everything before?
Oh my God. This is
like, we don't know what to do. I tell people, I said, okay, we were taught a mantra. It's funny because you hear doctors say this all the time, right? Oh, doctor, how do I improve my health? Oh, you need to eat healthy and exercise and reduce stress. That's it. This is like a mantra. 3 simple.
And how do we do that? They're like, I don't know. Whatever, healthy.
You just do it, right? Yeah.
Just do it.
Look online how to eat healthy. Yeah. They may know a little bit and you don't eat junk, but it's so limited and it's so sad because it can only get you so far. There's a whole world of how you can.
Oh my God. And also, not only are the diagnoses only for the medication, but it's the only way to bill. You can't bill if there's no ICD-10 code. And I want to say that
it forces me to give a diagnosis in a medical chart.
Forces you to give a diagnosis.
Like I can't just close a chart with no diagnosis.
Yeah, you can't close a chart. Now, I just want to say to everyone listening, there's no malice. Like, your doctors are not malicious. They went to school to help people, but they really think that they're helping people. And if you have a diagnosis, they probably are helping you. But if you're in the world of pre-diagnosis, what I call pre-disease, There's no room for you here. If you're
No,
trying to
they tell
prevent, there's
you,
no room for
yeah,
you here.
we checked.
What's a
You're fine.
wellness visit, right? A wellness visit just means if you don't have sickness, it doesn't mean you're well.
Yeah, keep doing whatever you're doing. Yeah, that's.
Okay, so then it's funny because you said
so
to me,
another thing is I
yeah,
want to stress is that if I want to, for example, if I'm risk averse, if my whole goal is to protect my livelihood and to have a comfortable living and I never have to worry about anything, I do exactly what they taught me, because as long as I prescribe these medications, right? I diagnose and then I find the medication for you. Doesn't
you're
matter the
good.
medication. Go look up any FDA approved medications. Look at the serious side effects, a whole long list. Look at the common side effect, even longer list. So if people have any of those effects, including death, I
Not my
am
problem.
getting off scot-free.
You're
Absolutely
good.
no consequence, even
No
if people die.
Correct.
Yeah. So they never have to worry about their license, never have to worry about medical board coming knocking on their door. They never have to worry about anything,
Just follow the algorithm.
even if they're causing so much damage.
Even if they never get better.
Yeah, it's okay.
It doesn't matter. As long as you follow the protocol, it doesn't matter. You stay safe.
Yeah. So what I realize is that my soul won't let me do that. I can't.
I'm with you.
My goal is to improve people's well-being. My goal is to make the world a happier place, right? Less suffering and more spirit, more happiness, more love. So if I know there's a way for me to get them to suffer less and I don't do it, I can't live with myself, period.
100%. So what are the type of patients that come to you? What are the things that you could treat with stem cells?
Oh gosh, so many kinds. People fly from all around the world. I would say 75% of our patients are people who have serious condition. So either it's autoimmune conditions, because stem cells really shine when it comes to autoimmune diseases. There's so much research going on, from rheumatoid arthritis, lupus, psoriasis, or MS, or thyroiditis, a whole slew of autoimmune, and Crohn's and ulcerative colitis. And then for serious brain conditions, right? Conventional medicine have nothing to offer. That's why I didn't go into neurology, because I knew how depressing it is as a field. All you do is diagnose which brain region had problems, and then you're done. You're going to tell people this is not treatable.
You're done. It's so crazy. I'm sorry. I had Dr. Bernison on here. I was telling you earlier, who was like the godfather of Alzheimer prevention. And he says the same thing. He says, you go to neurology just to be told. And if you go to neurology and say, hey, I think I'm having some brain fog, they're like, oh, okay, well, you passed all the mental exams, mini mental. I'll see you. Come back when you fail the mini mental. Right. And then you get the diagnosis and you're like, okay, great.
And even you're diagnosed, they don't really have, they have a couple
tools. There's no tools.
That barely is making any dent on the decline.
Tools.
Yeah.
It's crazy.
So it is crazy. And what's funny is, a funny story was, I was trained at the VA hospital. So we had a award for geriatric psychiatric patients. So the geriatric psychiatrist was going to Alzheimer's conference every year. So this is 2000. I remember I was doing the rotation probably 2002 or 2003. And he said, yeah, the government is giving, I forgot how many $1 million per year. He said, I'm going to these conferences, Alzheimer's conference every year. And believe me, in 10 years, we'll be able to find the cure, right? 10 years, let's just say 2013 came and went.
They're looking for a pill.
Yeah, because your linear approach doesn't work. Because it's not a single cause disease.
It's not a single cause disease.
For a single solution.
My God. It's not a single cause. That's exactly what Dr. Bernison, he said, the reason I can't get funded for research is because they will only research one variable. And it's not one variable disease. We've got to change this idea. Everything is connected. The whole system is needed. So do people also come to you just who are interested in longevity medicine?
Yeah, they do. But yeah, to finish on my list, so people with, of course, so Alzheimer's, Parkinson's, ALS, traumatic brain injury, spinal cord injury, or people with all kinds of internal organ issues, from the lungs. Lungs, I love treating, because it's just, that's the first thing the cells go to when I put in the veins, and they work so well for lung conditions. And it's so devastating to can't imagine anything worse than not being able to breathe. And heart repair, cardiovascular conditions, diabetes, people with kidney diseases or sexual organ issues. I've seen improved fertility. and liver cirrhosis, all kinds of musculoskeletal issues, autism, just a whole slew, all kinds of skin issues, or people want rejuvenation for the face and hair. But yes, about 25% of patients come in because they don't want to decline. They don't want to do the normal aging. Who said is normal?
No, I'm with you. Who said that's normal? I'm with you. So is it the same process regardless? So like, for example, for me, it almost doesn't matter what you're coming with. If I can reduce your inflammation, get the source of the trigger of what's causing your decline, right? That's what we were like, is it mold? Is it Lyme? I can affect just about any disease that you're already coming with because there's this one common denominator, which is the source of inflammation. And just if I remove inflammation, it will affect, this is what I want to say. If I remove inflammation and find the trigger, I could affect many disease processes at the same time.
Exactly. So I tell people there's three main things, even if you have a condition that there's no research data on, because I always go by research. But if there's nothing that's really researched on your particular condition because it's more obscure, if your condition has anything to do with inflammation or anything to do with immune dysregulation or has anything to do with tissue damage, then stem cells is a great fit because it's powerful in these are the three main areas that it can bring about changes. So yeah. What was your question?
Is it the same treatment regardless of what I'm coming in with?
Yeah, actually it is very similar. This is why it's so elegant, right? I always don't want to take credit for knowing what product to give people and put in the body, but the cells seem to be able to do the rest. Of course, there are times you want to give the cells through IV route, times you want to put in local injection. There are nuances to it, and it is better to do a combination sometimes. But the approach is very similar because we're counting on the intelligence of the cells.
Right. The approach is similar.
Very similar.
What is the experience? What can someone expect? They find your website. What's the patient experience?
Yeah. So we do a detailed consultation first. So we spend a lot of time with patients, usually remotely, but they're welcome to come in. And we go through their medical history, look at exactly what kind of help they're looking for, and to see if stem cells are appropriate or exosomes. We use both, and often in combination. 2, how are we going to give it to patients? Do we do a systemic approach? Do we do local injections? And how much of the dose is necessary, because we individualize it. A huge person should not take the same dose as a small person. There's dose specific. And then there are a lot of adjunct therapies that we use, like we use ozone therapy along with stem cell therapy. We also use different supplements to enhance the body, enhance, let's say, blood circulation, enhance the mobilization of cells, enhance the detoxification of your environment. It's like priming the soil for the stem cells, who are the seeds, to come in and flourish. And we also use laser technology to help direct the cells. So during the infusion, we can use laser technology to get to places that's hard to reach. And it's pretty awesome.
That's amazing. Are there any downsides?
I've had people who are very anxious patients who had scoured the internet to look for problems and side effects and potential issues with stem cells. And I remember this one patient said, I can't find any because it's very safe. It's extraordinarily safe. Like any procedure, if your doctor put in the wrong place, right? Inject where they shouldn't inject. For example, the people who blinded people in Florida, their clinic got shut down, right? US stem cell clinic, because they injected into people's eyeballs and they did 2 eyes at the same time. So there are risks in where you put the cell, and you know what you're doing. But you don't ban a treatment, a particular therapy, just because they're bad practitioners, right?
Yeah.
Just let's say surgery, knee replacement surgery. If one doctor did a terrible job and really messed up a person's knee or even caused death, do you ban the entire knee replacement? Do you say, now we've seen bad things happen with this surgery, now the surgery is banned? It's equivalent, right? If you say, oh my God, 100%. Some bad things that happened to somebody because the doctor didn't do things right, you don't ban an entire therapy. So that's the kind of, but when it comes back to safety, it's extraordinarily safe if it's done correctly. If you are doing injection, there's always a possibility of injection site, retinas, swelling, pain. But besides that, once in a while, Some person, it also depends on what kind of cells you use. If you use native cells, which are unmanipulated, which means they haven't been altered by any chemicals or enzymes, and they haven't been grown in a culture to huge numbers, then these are unmanipulated cells. They don't express surface markers that can cause rejection, and they don't send these inflammatory molecules.
Sure.
Because when you grow the cells, then it can cause problems. Then these cells, these native cells, can adapt to the body and work so much better. I don't see cytokine storm that Tony Robbins was talking about. Oh yeah, you get stem cells, you're going to get cytokine storm. No, I've never seen
We don't want
cytokine
that.
storm because we don't process the cells. We don't produce those kind of changes that will cause the body to react.
It's so interesting that you said that,
drastically.
because it's like in my world sometimes, because I will help people detox, especially from mold. And some people say, well, you're supposed to feel it. And Herc's reaction, we're like, no, you don't want that. We're not supposed to make you feel unwell as we detox. We should we should titrate to where you don't feel it. So it's interesting that there must be some schools of thought where if you really feel the pain, then you have the success, but that's not.
Yeah, you don't have to. I'll give
don't
you an
have to.
example. One of the patient I treated, we actually did a testimonial, like a interview. So this is a 9/11 responder who had a lot of his colleagues. He was in the ditches, in the debris for months. So a lot of his colleagues in their prime have died, and he was having this severe lung disease for, I don't know, since 9/11 for a very long time. And he took matter in his own hands and started searching for solutions until he heard Joe Rogan talking about the stem cell clinic in Mexico. So he went there. He did receive benefits, but it took 2.5 months for him to actually notice benefits in his lungs. But he got extreme fatigue for 2 months. Not only him, but everybody that were there, about 20 people, they all kept in touch. Everybody got extreme fatigue for months. But those are the cells that have been expanded. When he came to my
not the
clinic,
native cells.
Yeah, when he came to my clinic using the native cells, absolutely no fatigue, increased energy. And also he started noticing his breathing was better after 3 days. So this is a drastic difference. I used a fraction of what the cells, how much they were using overseas. But the benefit could be way better with way less side effects. So when you talk about side effects, you have to look at what are you using?
Sure.
What kind of cell?
And why is it that others are not using the native cells then?
Because of the research. Most research, we're talking about 1 million cells per kilo of body weight. That's a number in all these research. So then people think, oh, I need 100 million cells. And people go to 200, even 300 million cells. They think that's better. But not enough research has been done at cells that have not been expanded and comparing these two. But I did see a study looking at native cells, comparing them to expanded cells. And what's interesting was that they saw a dose response result curve when you give a lot more native cells, right? A small amount of native cells, 10,000 native cells, and has certain amount of benefit. And when you give them 100,000 native cells, it has a much higher level of effectiveness. But then you give them 10 times that, 1 million cells, but those are expanded cells. Guess what? You have less benefit. So it's not like you give more, you're going to get more. You actually get less.
So not only do you push the envelope in general as a medical disruptor by being someone who loves and promotes stem cells, but then within your own stem cell community, you're doubling down and saying, no, this is the way to go. We're going to go with the native cells. You need less. Less is more in this case. And I love that. It's similar to the world, just in terms of the pushing the envelope of like bioidentical hormone replacement therapy. We almost have to say to people, there is a limited amount of research, although it's getting bigger and bigger as we go. But the old research on HRT is the wrong research. And where we are now with HRT, you have to be willing to read the literature and understand that this is cutting edge. This is the way to go. And a lot of my patients will go to their providers, their GYNs, who are telling the exact opposite. Don't do that, and you don't need it. And they're in their way of longevity. They're in their way in longevity because you really cannot play the longevity game, especially for women, without BHRT. Like you just can't. You can't become estrogen deficient and progesterone deficient and expect to lead your best life, right? Cardiovascularly and brain and all that. So I constantly find myself having to tell people, just trust me, this is the way to go. This is the way to go. And because Dr. Bredesen said it best. He goes, look how many people we're helping. Look how many people have gone with his protocol. How many people have come through your clinic? Look how many people we're helping.
It's sad. I see people really believing they're conventional doctors, and so they forego certain therapies that could really transform their lives or even save their lives. They're so hesitant. They're so scared of
hesitant.
things. They end up losing their lives. So is that worth it?
Yeah. And it's unfortunate because, again, the conventional medicine docs are not informed on these topics.
No, they're
not
living
informed
in
on
their
topics.
pharmacological bubble.
Yeah, so they're telling people not to do it. And I'm just thinking of one particular client right now. She's not in my state, so I can't prescribe. And we've consulted with her. This is what we suggest. And she's just hitting walls because she can't get prescribed. And to watch her navigate the health maze it's heartbreaking because everyone's, no, you can't. I'm not going to do it. I'm not going to do it. I'm like, and she's like, I'll sign whatever you want to sign. I just need someone to prescribe it for me. And it's painful to watch. It really is. And I don't mean to suggest earlier that they should just have faith in us because we said it. There is data out there. It's just not as robust as the pharmaceutical data. Because
I beg to disagree. Yeah. I looking at the approval process from the FDA, and there's so much fudging of data from pharmaceutical companies.
That's what I'm saying.
And there's a slight improvement, and they count that as the reason to approve a drug that has an incredible amount of side effects.
I'm sorry. When I said robust data, I didn't imply that it was
were you doing
data.
air quotes?
No, it was robust in that there's a lot of it.
Oh, okay.
There's a lot of it, but it doesn't mean it's highest quality, and it doesn't mean it's not with an agenda.
Yeah. Yeah. I really have to remind people of how much damage have been done by things that are FDA approved. So I almost laugh these days when people say, what you're doing is not FDA approved. I would like to, would you like to see all the things that have been FDA approved and how much damage it has done to people? So if you think that's God's word, that this is good just because there's FDA approval, I really think you need to start to look at some evidence. Otherwise, you're living in some kind of delusional world.
Yes. And so yes, I agree with you. I think what people fail to understand is that in order to run some of these very big studies, you need the very big pockets of pharmaceuticals. And they're going to only study things that lead into sales. And that doesn't make that research any better.
Yeah. And what's interesting, I don't know if it takes on average $2.1 billion to bring something to market after FDA approval. Right. So who has that kind of money? So just think about it. Who has that kind of money?
That's exactly my point. And it's funny that you said that because I've gone to a lot of people have skin issues, psoriasis, eczema, things like that. And without question, once I clean up their nutrition and heal their gut, their skin gets better because I say the skin is the neon sign for belly. When I brought it up in many dermatological conferences that I used to go to, I don't anymore. They would say to me, there is no proof that any type of elimination diet has any effect on skin. And I'm like, I don't know. Anecdotally, I see it all day long. Also, there's no side effect if I tell you to go dairy-free. Okay, so you went dairy-free if it worked, if it didn't, right? And so I always tell my patients, who's going to fund that study? Who's going to fund the study of go dairy-free and see what happens to the eczema? Nobody. No one's going to fund it because there's nothing to sell behind it. So so when people say to you, there's no data that going dairy-free affects your eczema, although I think there is now, the question is, who's funding that? If there's no end result in sales, so there are some smaller studies that are done that are less funded, but that is the reason. That is the reason. People know that. Yeah.
Yeah, that's great. I applaud your effort to bring it into mainstream.
No,
apparently
it's not in mainstream.
You would think these doctors would be so excited to hear something so simple that could really help their patients, and it's really sad. Yeah, it's
Yeah,
sad.
it's
And
sad.
doctors are just people. Some
With their own
doctors
biases.
who are more open-minded, have a pioneering spirit, and some doctors they would like to just go with what they've been told, and anything that's beyond that, they would find a way to reject. And then they tell you what's in their bubble. And so unless you are a patient who wants to actually take your own health in your own hand, if you just go along with your doctor, I'm sorry, there's limitation to that.
There's limitation. And I say it's not an either or. It's both. Use all of them. Use their tools for what they're great at. Use your use all the tools. The problem is that people insist on using one set of tools without acknowledging the limitations, right? I don't
Yeah.
think it's either or. I think it's all.
Yeah.
Yeah.
And there's also a sense of arrogance, I think, in conventional medicine, saying, because you've braved those conferences. I don't even go to those conferences anymore. So if you
It was
go
a
to
long
those
time ago.
conferences, then, okay, so you're not a masochist. So then you will get those rejections and ridicules. But if that's the thing, if you want something that's beyond, you really have to look at their arrogance is based on ignorance. And that's really sad because the medical apparatus is like a juggernaut. It's a giant that moves so slowly, right? The current treatment is always 20 years behind research. Imagine, do you have 20 years to wait? That's what the medical community is doing. It's waiting for 20 years to give you the latest solution. And people like you and me who are in the more approach, we are always reading new research. We're catching new research.
Yes.
And we're giving that to people immediately. So we're a smaller group that's always trying to feed what's new to patients. So that's what people need to understand.
Absolutely. Tell me and tell my audience anything else that maybe I forgot to ask about.
I think there are a lot of myths about stem cells, and it's just mind-boggling how it persists. One is that people think you have to go overseas to get stem cell therapy. And that is just completely wrong. And it serves the clinic overseas really well because people think that you can only get it overseas. But the truth is the number of stem cell clinic in the US has quadrupled in the last 5 years. This is all under the radar of everybody because you can't advertise for it. So Google will shut your ad down.
You're not allowed to advertise for it?
Yeah. No, if you mention stem cells, they're just not going to run it. Instagram, Facebook, you're not going to get it approved. Even something, I had somebody who got rejected for, what was he doing? Oh, testosterone replacement. Because on his website, he mentioned PRP. And PRP has been proven extensively. It's covered by multiple insurance companies. But I think it was Google. And they said, he showed me the letter they wrote. We're rejecting it because on your website, you mentioned PRP. And this is part of the cluster of treatments that are considered unproven therapies. It's like, when did Google start to practice medicine?
No. That's wow. So they can't be advertised. So really podcasts like this is the only way to get the word out.
Yeah. Yeah.
That's crazy.
And Google, you can, I guess you can talk about it, but at a clinic, you definitely can't run ads. And when doctor puts stem cells on their website, they also run the risk of being combed through by government agencies because they are not excited about stem cells. And there's a lot of, some people use regenerative medicine. Even that word has been flagged. So there's a lot of things against just the doctors trying to get more people to do the treatment. Even with that kind of suppression, the number of clinics has quadrupled.
I'm sure that people find you.
People find me. I'm more vocal than most doctors, but even other doctors who are doing it under the radar, it's the patients who are driving this. Patients want it. It's not the doctors who are saying, hey, I do stem cells. Do you want stem cells? Yeah. It's the patients who say, hey, I heard stem cells are really great. Do you offer it? I want to do it. And that's more of the case.
It's so funny.
So many doctors have come to me saying, hey, I already got 4 people who asked me about stem cells. I don't know how to do it. Can you teach me? So
and that's when you started the program to teach.
Yeah. So I actually started an academy. We certify doctors on how to do stem cell treatment. So the academy name is American Academy of Integrative Cell Therapy. So we actually have certification program. It's a 2-day program, really getting doctors up to speed when it comes to
Wow.
this new therapy.
That's amazing. That's amazing. Okay, so what you want everyone to know is you don't have to go overseas. You can come in the States. And it sounds almost like, honestly, your
Yeah.
technology is also
Yeah.
better with the
And
native
more is not
cells.
better. More cells
More is
doesn't
not
make it
better.
better. So I talk
This
about
sounds like
depending on what kind of cells you're
Yeah.
using. And also using your own cells may not be better. You think that, oh, I use my own
Sure.
cells, so there's
Your
no
cells have
rejection.
damage.
But guess what? You're not using the cells. The purpose is not have these cells go into your body and start to make new tissue for you, because that's not how they work. Research have been proven time and time again. It's so repetitive. All these research studies, they said, okay, now we realize the effect of these improvements. We've seen improvements is not because the cells actually differentiated and formed the new tissue. It's because of these signaling molecules that your tissues own stem cells. So new tissue is from your own body, right? From when stem cells from someone else is given. So they've shown the majority of the benefits is not because we're relying on the cells to differentiate and form new tissue in your body. It's because all these signaling telling your own body stem cells to wake up and start form new tissue. And so not only your own stem cells have declined in number and also declined in quality because they've been with you all your life. When you're in your 40s, the number of stem cells is a quarter of what you had in your teenage years. And when you are in your 80s, you're 1/5 amount of cells when you had when you were 40 in your 40s. So you're falling off a cliff. So there's less cells, and the cells are more
less quality
because they have been damaged by all these oxidative stress, all these whatever environmental toxins. And then also they've lost certain intelligence. So there's a concern about stem cells possibly exacerbating cancer. And those are, for the majority of the time, is really regarding your own stem cells. We have shown your own stem cells, because it's older, it tells everything to grow. It's not telling cancer cells to actually to go die. But younger stem cells still have that capability. They actually had direct side-by-side study looking at fat-derived stem cells making cancer grow, and then umbilical cord stem cells making cancer go away. If you use your own cells, you're taking that risk, because we have cancer appearing all the time. If you all of a sudden you put this large dose telling everything to grow, there's a potential. But if you use umbilical cord cells, that has been used a lot. Also, bone marrow stem cells have been used a lot for anti-cancer treatment. So there's a lot of research, like very active area of research. Umbilical cord cells will actually help you get rid of cancer. And that's the overwhelming evidence.
Wow.
So using your own is not necessarily better. So I think those are some of the major points that people need to understand.
I'm so glad you told us that. So we don't need to go overseas. More is not necessarily more. And you actually don't want to use your own, because
I don't.
Yeah.
I've been using umbilical cord stem cells on myself every 3 months for the last 8 years.
Wow.
Yeah.
That's amazing.
I've got
And that
cells
speaks
from a lot of
volumes
people.
when you do things yourself. Everything I have my patients do, I have done myself as well, to myself and to my wife. And that is, you want to hear that when you go to someone.
Yeah, absolutely.
Tell people where they can find you, please.
Yeah, so my YouTube channel, just find Joy Kong. So it's Joy Kong MD. And my website is drjoykong.com. So JOYKONG. You can find me on Instagram, Dr_Joy_Kong. So these are the 3 best places to find me.
I love that. From one medical disruptor to another, it's an honor to know you.
Oh, you're so kind.
And just don't ever stop. We need you. And I'm probably going to set up a consult myself.
Oh, that's fantastic. I've been so vocal about stem cells. And I think some people have expressed concern for my safety. And we've all known, you've heard about integrative medicine doctors, cancer doctors had mysterious deaths. They all of a sudden decided that they don't want to be on Earth anymore. So here's my chance to make a disclaimer. I'm not depressed. I'm actually very content and very excited about life and about what I can do. I have no intention of ever disappearing unwillingly or willingly. I'm actually, it will be, I wouldn't mind disappearing at the end of an old age, but not when I'm doing
if someone puts a suicide note, it's fake.
Yeah, it's sad. I don't operate in fear. None of us stay here forever, right? I'm going to fight the good fight. but I still want the world to know. I want to be here.
Yeah. I love that. Fight the good fight, Dr. Kong. We love you
Yes.
for it.
Oh, thank you. Thank you, Dr. Yi.
Thank you for being here. Really a pleasure and an honor.
Oh, it's such a great conversation. It's so fun.
Thanks.